dream of a hospital to serve the people of Lennox and Addington became a reality in the fall of 1958, when Dr. Brant E. Bergstrom, Dr. Robert A. McClellan, and H.D. Whiteman sat down for lunch one day to discuss the idea.
The idea wasn't new. Similar discussions had taken place almost 40 years earlier, but due to lack of money, it never got past the discussion stage. Dr. Bergstrom and Dr. McClellan knew the time was right in 1958. Kingston and Belleville hospitals, used by Lennox and Addington residents, was operating at a greater than 100% capacity.
The Ontario Hospital Insurance Plan, OHIP, was set to start on January 1, 1959. It would ensure the costs of operating hospitals would be met by a general insurance fund, rather than municipal taxes. The planned extension of Highway 401 promised easy access to services in Kingston and Belleville, including health care. If a hospital wasn't started now, thousands of consumer dollars would go elsewhere.
With few exceptions, most people thought the hospital plan was impossible. Again and again, County Council rejected it, with some councillors more in favor of a seniors-type residence.
Formation of a hospital auxiliary was discussed by the Hospital Association as one of the most influential bodies to obtain the goal of constructing a hospital, and it would add pressure on public opinion through continuing education and organization. In 1963, the auxiliary was formed at a meeting at the Memorial Building.
Other prominent members of the community joined the original group of three, offering ideas for the new hospital and creating excitement. With more people to share the work, they were able to give presentations throughout the community. After one meeting, the minutes read, "The general enthusiasm present should not be allowed to die."
They had advertised a general public meeting in the Memorial Building, started it going, and with the idea that might be a few people show up. It ended that the auditorium was packed out and the street was full out in front of the Memorial Building, showing a deep, deep interest in the community of people that really want to see a hospital happen here. My father was chair of that meeting, and he had a huge, huge interest in this hospital being started here.
To gain support from the public and from County Council, hospital supporters sent out 2,000 questionnaires. The results? 70% of residents polled favored construction of a hospital financed by a county debenture issue. Pledges began rolling in. In 1961, the Napanee Rotary Club announced a donation of 8 acres of land and $20,000 cash, a sum later matched by the Napanee Lions Club, followed by the Kinsmen and the Legion. In 1965, Lester B. Pearson was the Prime Minister of Canada. Canada adopted a new flag. County Council announced its full support for the hospital. In April, a contract was signed with Ball Brothers in Kingston to begin construction, at a cost of $1.6 million.
The hospital first opened on March 22nd, 1966, with a total of 78 beds, 145 staff, full-time and part-time. 74-year-old Robert McFarlane of Napanee was the first patient, and within 48 hours of the hospital's opening, our first baby was born. In 1966, 730 patients were admitted, 90 babies were born, and in that same year, our Board of Governors was established.
The Lennox and Addington County Hospital was officially opened on September 10, 1966, by the Honourable Earl Rowe, Lieutenant Governor of Ontario. For the rest of the 60s and into the 70s, the hospital served the needs of the community. In 1977, a feasibility study was conducted for a coronary care unit. The 2-bed unit served 140 patients in its first year, prompting an expansion to 4 beds. Over the next 18 years, services to patients exceeded all expectations. This led to a campaign to expand ambulatory care and upgrade other areas of the hospital. The 1984 expansion totaled $4.5 million. Once again, Ball Brothers was chosen as contractor. The new addition officially opened on September 14th. In the early 90s, cutbacks in healthcare funding curtailed further expansion. Layoffs and bed closures in 1992 and 93 were necessary to avoid a budget deficit.
It became clear in the early 90s that funding was required to purchase equipment in hospitals. As a result, the Hospital Foundation was formed in 1995 to receive donations from our community.
The Ministry of Health approved the plan in 1992, including redeveloping the outpatient area, emergency services, administration offices, operating and recovery rooms, as well as exterior improvements. The obstetrics department was remodeled into a family-oriented birthing center. 10 years later, the province provided $11.2 million for hospital redevelopment, expanding the number of beds from 32 to 55. Other additions included the new Meditech patient tracking system in 2004, a cataract surgery unit in 2005, plus the addition of our first nurse practitioner in emergency in 2005. The official sod turning for the expansion was June 16, 2006, with a grand opening in October 2009.
By 2008, the world was starting to go digital, and the hospital had to keep pace. The radiology department was still capturing images on film and asking patients to pick them up and take them to a specialist.
Well, first and foremost, the quality of the imaging and the resolution improved dramatically. It also allows local physicians to consult specialists in Kingston in real time. We'd never had that ability before. Up until about 2010, the patient and the films would actually physically have to go to Kingston.
In 2008, the Hospital Foundation established a digital imaging campaign to raise funds for a new digital imaging service in the hospital. Amazingly, a total of $3.7 million was raised in less than 2 years.
In 2011, a new bone mineral densitometry and mammography suite was opened, followed by a cardiac rehabilitation center in 2012. A multidisciplinary team could now offer patients individual cardiac rehabilitation. Also in 2012, a chemotherapy suite opened, allowing a nurse, pharmacist, and pharmacy technician to administer the required drugs in a comfortable setting.
Today we have an emphasis on general medicine, convalescent care, and general surgery. We operate on a budget of $20 million. The hospital employs approximately 250 staff with 99 credentialed physicians, a radiologist, and 3 surgeons.
Our hospital has always been about community involvement. Our hospital auxiliary was renamed Volunteer Services in 2006, and our volunteers are here to help the patients, help the staff, and to raise funds for the hospital. And the hospital would not be the same without our volunteers.
Over the past half-century, the County of Lennox Addington has forged a strong partnership with the hospital through participation in its governance and through funding provided in support of numerous capital projects to enhance the facility and its services.
The future looks bright for our hospital with new improvements on the horizon. The Westdale Public School and the L&ACGH home were recently purchased by the Foundation and the hospital with the support of the community. In 2016, the Westdale Complex will host a new Kingston General Hospital satellite dialysis unit. The L&ACGH Complex, in conjunction with Pathways to Independence, will be the new home for a 6-bed acquired brain injury facility. 5 new outpatient specialty clinics have been added to our already busy ambulatory centre. They include pediatrics, respirology, dermatology, and specialists in rehabilitation.
By partnering with our community, working together, we're growing as a successful healthcare service provider.